is. They're a very basic form that contains nucleic acids, either viral DNA or viral RNA, but they can't replicate themselves. So they have to enter a host cell. In many cases, I'll just be saying us, and they have to use our machinery in order to replicate. Because they can't replicate themselves, there's a lot of argument as to whether they should be considered alive or not. I say they're not. Dr. Stamper incorrectly says they are. So because I have to be right, I looked it up, and among the top virologists in the world, they don't agree. So I guess it's up to you to decide Stamper versus Bueller. Regardless of the alive or not argument, we know that viruses have a very basic structure. They've got a capsid, that's kind of the shell that's around the virus that's going to contain all of the elements inside. Many viruses have a lipid membrane, also called an envelope, that they acquire as they exocytose out of their host cell, kind of wrapping the capsid in the lipid membrane as it leaves. And having that envelope that looks like the cell membrane of the host cell helps reintegrate into the next host cell, and it helps trick the immune system into thinking that it's one of our cells instead of an invader. Very importantly, some viruses contain glycoproteins that are on the outside of that lipid membrane or envelope. And these are what we see here, kind of sticking off, looking like those little spikes. And these glycoproteins can specifically attach to components that are sticking on the outside of the host cells. So that's how a virus can identify a specific type of host cell, attach to it, and then enter into it. No matter how it gets into the cell, no matter what the external structure is, all are going to carry their own nucleic acids, so their own genome. It can be either RNA or DNA, and they'll contain any necessary pre-made enzymes that they're going to need to get everything kick-started. So I created this very basic diagram of the viral life cycle. If you are a virologist, you're probably going to laugh or cry, but this is going to give you an overview of how a virus is going to replicate so that we can go into individual virus types and start to plug drugs in. So in step 1, we've got docking and fusion. So the virus is going to come here. It's going to bind or dock to the host cell. And we said we had those glycoproteins on the outside of a lot of viruses that we're going to recognize and selectively bind to molecules on the outside of the host cell called host receptors. And so once that virus binds, it can then fuse to the membrane and then be endocytosed. It's pulling in the viral enzymes and whatever nucleic acid that virus has, DNA or RNA, and those are going to be released from the viral shell into the cytoplasm, and we call that uncoating. While inside that host cell, the virus is going to have reproduction of all of the proteins that it's going to need to create new viruses, also called virions, and it's going to have to reproduce the nucleic acid or genomic template that it needs. So for the most part, their virus is using the host cells in order to make these things. Viruses do not have their own mitochondria, so for protein production, they have to use host mitochondria. Most enzymes, they're using the host version, but one exception is that many viruses have their own nucleic acid polymerases. After replication of the contents and structural elements of the virus, those are going to be sent to the membrane packaged together, and then those virions or baby viruses are going to be exocytosed, also called budding. Sometimes if you have too much budding in terms of you're releasing too many virions at once, you can actually burst the cell and the host cell itself will die. So that brings us to the topic of why do we have the symptoms that we have when we have a viral infection? So anything that activates your general immune system, whether it's a bacterial infection or a viral infection, is going to cause that general fever and fatigue. And so that's going to be all viruses. And it doesn't depend on what type of cells they use as their host. If your immune system is able to see them, then you're probably going to get these kind of general disease symptoms. However, the very specific symptoms that each virus has are going to depend on what type of cell has been infected as the host cell. So as I said, the viruses themselves can kill the host cells during replication, so you can get this damage and loss of cells in whatever organ or cell type is being infected. And then the immune system comes in, senses that there's something wrong, starts to cause local inflammation in order to keep the infection down, and in some cases that local inflammation is enough to cause some damage to those host cells as well. The idea, though, is keep that infection down long enough for the rest of the immune system to get on board. And if you lose a few cells while you're doing it, it's worth it. So you've got actual death of host cells from replication, and you've got local inflammation. Both of those are damaging those host cells. So if you look at the type of host cell, you can generally figure out what type of symptoms the disease is going to have, and vice versa. If you know the symptoms, you can figure out what the host cells are. And then I'm going to have you brainstorm some of the example viruses that act at these host cells. So if the T cells in the immune system are the host cells, then you're killing immune cells themselves, and you might get immunosuppression, and if very severe, acquired immune deficiency syndrome. If the host cells are mucous membrane cells, such as in the lips, in the mouth, in the genitals, you could get cold sores. If the host cells are intestinal endothelial cells, you can get viral infections that include vomiting and diarrhea. There are multiple different viral types that attack hepatocytes. So that means there are multiple different viral diseases that we call hepatitis. Because all we mean here when we say hepatitis is dysfunction in the liver. So any unrelated viruses that are going to attack hepatocytes are going to cause hepatitis. However, since they're unrelated viruses, you might have to address them in different ways. We're familiar with a lot of viruses that attack respiratory tract cells. If they're attacking those upper respiratory tract cells like the sinuses and the nose, you could get very simple things like congestion. You could get a sore throat and cough. If you have infection in the lower respiratory tract, in lungs, you could get bronchitis, you could get pneumonia, and if very severe, that low oxygenation and local inflammation can cause death. So when I talk about inflammation and its role in response to a viral infection, here we just said, oh, you have some local inflammation, by which I mean it's acting on that tissue itself or on that particular organ. However, with some viral disorders, some people can have an overactivation of their immune response. And that activation of their immune response can end up going systemic. It can end up attacking organs and systems that never should have been attacked. And so we call that a cytokine storm. And if you guys remember, cytokines are those inflammatory mediators. A lot of them are peptides. When they're released, they can act directly on cytokine receptors on cells. They can increase reactive oxygen species. They can change the pH. They can attack local cells in multiple ways. Cytokine release in a very small area, like on the trigeminal nerve when you have a migraine, can be very painful, but it's not necessarily deadly. With a cytokine storm, you're having the entire body really overreacting with this intense inflammatory attack. And that can cause pericardial damage. It can cause more pulmonary damage. It can be lethal. The last effect that we can talk about is that on host cell proliferation. And so we talked about a virus infecting a host cell, replicating itself, and then either being exocytosed out slowly or exocytosed out very rapidly, bursting and killing the host cell. Bursting and killing the host cell gets a lot of virus out very quickly, so evolutionarily that's potentially a good idea. But it doesn't leave that cell there to keep making more in the long term. So a different strategy that viruses have used is to use epigenetic modulators that activate the host cell cycle. So even tissues then that should not be undergoing growth, where the cell cycle should be halted, the virus comes in and reactivates it. So now those tissues start growing. That tissue growth could be non-cancer, tumor growth, or it could in fact be cancerous. And so some viral infections do in fact cause cancers. So one really important aspect of the viral lifespan in your body as a host is what happens in the cells once they are infected. And so we talked about that a little bit. We said the virus finds its host cell, it's absorbed, and in many cases, it's going to multiply very quickly, causing death of that cell, which they're calling here lytic infection. So lytic for lysis. And that other effect could be that transformation into a tumor cell by modifying genetic expression. In the case of lytic infection here, you can either die from the virus or you can fight it off. All of the cells that had been infected are dead, and now you've recovered completely from the infection. So in lytic infection, you can have 100% recovery. However, not all are going to kill their host cells completely and be able to be completely gotten rid of. If the cell that's infected, instead of multiplying greatly, if instead it has a very slow replication of the virus, it could do a couple different things. It could stay here in a fairly healthy cell and just persistently keep making very small amounts of virus. So we consider that infection to still be active because you're still making new virus constantly. You have an active infection. It's just a very low, slow infection process. So you can have this over years, but the infective process is still occurring. The final possibility is latent infection, and latent means it's kind of hiding. But you can look at it if you want to remember it and see the word late, so it's hiding and it'll come out later. In this case, the virus goes inside the cells, but it does not continue to replicate. It just stays there. So now it's not causing any damage to the cell, and there's no way that the immune system is going to realize there's a virus there. So it's just kind of hiding out until later. Then at some point, something reactivates that viral propagation, and if your immune system is low, say you're under a lot of stress, you have poor nutrition, you're in pharmacy school, you're getting older, anything that's decreasing your immune system function, now that latent infection can reactivate, pop back up, and you can have a reoccurrence of it. And so viral infections that completely go away with 100% recovery include things like influenza. You get influenza, you completely clear the virus, and then you're recovered from it. You might get another one next year, but you've completely cleared the viral infection you had. We see some of the hepatitis have this persistent infection where you don't really realize you have it, but it's causing this very low, slow, long-term liver damage. And then we have these latent infections, including human papillomavirus, chickenpox, HIV, where the virus can lie dormant inside cells for months or even years before coming back out and expressing itself again. For drug treatment, if your goal is to kill viruses that are actively replicating, then that lytic infection, you're going to be able to go in there and interfere with all that replication. You're also going to be able to do that to some extent with these slow persistent infections. But if you have a drug where you're focusing on selective toxicity by blocking the viral replication, and you give it to someone with a latent infection, they're not replicating. So no matter what you do with the drug right now, it's not going to get rid of the virus that's currently dormant. And so for things like HIV, we haven't figured out a way to actually eradicate that virus from the inside of our cells. So we're going to start classifying these viruses, and I'm going to give you a nucleic acid warning here. If you hate nucleic acids, you're going to hate this section of the lecture. The first thing I want to remind you is what a nucleic acid polymerase is. In this example, we have a DNA polymerase, and that is just the enzyme that takes the template nucleic acid and builds the new strand off of it. So if it's a DNA polymerase, then it's building a new strand of DNA, and if it's an RNA polymerase, then it's building a new strand of RNA. When we name these, they can become pretty confusing. For their full names, we're going to name them by the original strand type, whether it's DNA or RNA, and we're going to say dependent because it's dependent upon that as the template. And then we're going to have the second strand that it's making, whether it's DNA or RNA, and that's the polymerase because that's what it's making. So you could have a DNA-dependent RNA polymerase, or any combinations of those. So DNA-dependent means you're starting with DNA, and here you're ending with RNA. We can categorize these different viruses based on the type of nucleic acid they have and the type of polymerase they use. So if viruses come with DNA inside them, then they're a DNA virus, and they would need polymerases that could replicate their DNA to DNA, and they'd need polymerases that can convert their DNA to messenger RNA. If it's an RNA virus, they generally don't have to worry about DNA at all, and they're going to have an RNA-dependent RNA polymerase. The exception are retroviruses, which do start with RNA, but then produce DNA, and have to have a specific polymerase called reverse transcriptase in order to do so. And we call those retroviruses because retro is backward, and we never make DNA from RNA. We always do it the opposite, so we're calling them retro. So each of these three virus types is going to have different types of polymerases depending on what it needs to do. Evolutionarily, all nucleic acid polymerases are related. So the polymerases in bacteria, the polymerases in our cells, the polymerases in our mitochondria, and the polymerases in these viruses are all related to each other. But, of course, phylogenetically, they've each mutated differently, so they're going to be somewhat different. So just as we looked at bacteria having slightly different mitochondria than we have, we can also look at these DNA and RNA pols as being different between viruses and us and between different viruses themselves. So even different viral strains are going to have somewhat different forms of these polymerases. So these polymerases are, of course, absolutely critical because all viruses are going to need to find a way to replicate their original nucleic acids so that they can reproduce into virions. And they're also going to need to figure out a way to make messenger RNA. Some of them are going to come in single-stranded RNA to begin with, but most of them won't. So they're going to need to be able to produce both of these things. And in order to do so, and do so efficiently, most of them are going to come with their own nucleic acid polymerase, instead of relying on ours. And that's, of course, where we hit selective toxicity. We all have nucleic acid polymerases, but as we said, we have different ones. So when you look at what humans need to do, we start with double-stranded DNA. We have to replicate that when we produce new cells. So we need a DNA-dependent DNA polymerase for our own cell replication. And when we want to make proteins, we start with our DNA and we need to transcribe that to mRNA. So we have a DNA-dependent RNA polymerase, and both of those are specific to mammals, even specific to humans. Again, I mentioned mitochondria have their own specific ones as well, and that can come into some side effects due to selectivity issues with HIV drugs, but we'll get there. So we only have these two specific polymerases, this human DNA polymerase and this human RNA polymerase. But because viruses had these different nucleic acids they came with, they're going to need different forms. So these RNA to DNA viruses needed reverse transcriptase DNA polymerase, and we never do that, so that's a great drug target. Some viruses are going to go RNA to RNA, so that RNA polymerase is a great drug target. And then some go DNA to DNA. And although we do also have DNA-dependent DNA polymerases, they're often using their own version. So again, a place for selective toxicity. So these different types of nucleic acid polymerases gives us selective toxicity not only between viruses and ourselves, but also somewhat selective targets between these different forms of viruses. So just as antibiotics might work better at a gram-positive versus a gram-negative bacteria, specific nucleic acid polymerase inhibitors might work better at retroviruses versus DNA viruses.